Hey everybody, it is Dr. Carrie here from CJPT and Pilates, and October is Knee Pain Awareness Month here at CJ Physical Therapy and Pilates. So we are talking all about knees, knee pain, how you can get rid of it naturally so that you can avoid things like pills, procedures, or surgeries. So my latest article is literally about that. 6 tips on how you can help your knees naturally so that you don't have to rely on pills. I go over things like strengthening your hips and core, improving your balance, wearing supportive footwear, etc. So there's 6 of my kind of top tips that I talk about with just about everyone I meet, all my clients, and I wrote about them in the article. So if you want to click on that, you'll get to read more details into why these things are so helpful and how it can help your knees. Now, sort of a follow-up question I often get is, what if I can't do these things? What if my knee pain is too much, or it's been there too long that when I try these tips, it actually makes them worse? Well, now we're talking about a different problem. You may need to work with a specialist. Now, typically when people think, oh, I need to get help from, a doctor or a specialist for my knees, the typical thing is to go to see their medical doctor first. The problem is if you want a natural solution, if you want to avoid prescriptions, procedures, surgeries, that's not often what you'll get when you go to a medical doctor. They're just not trained that way. They usually want to take pictures of your knee, x-rays, MRIs, and sadly, that's not the way to go about it first, because what we know to be true is that, 60 to 70% of anyone over the age of 50 is going to have, quote, ailments such as meniscus tears and arthritis in their knees. But what we know is that there's plenty of people walking around with those so-called ailments that have no knee pain at all. So all that means is that you can't rely on the thing in your MRI or X-ray to be the reason for your knee pain. And if you rely on that, you risk going down a rabbit hole of treatments, procedures and surgeries, even medication that you might not need. So if you do have knee pain that is so bad that you can't follow some of the tips that I've put in the article, then you want to talk to a mechanical knee pain specialist. Why mechanical? Because if it 80% of the time, all knee pain, even things like meniscus tears, are what we call mechanical in nature, meaning they can't be seen in a picture, and they are resolved naturally with very specific targeted corrective movements and exercises. So, and again, you need to see a specialist. We happen to be specialists, so you can talk to us, but if you're not local, let us know. We can help you find one. But that's kind of my spiel about knee pain. It is Knee Pain Awareness Month here, so we're educating on that topic. But if you want to see my 6 tips for helping your knees without medication, click on the article and let me know what you think.